Welcome back to our channel. Today we're going to discuss a topic that affects many expectant mothers: managing gestational diabetes. This temporary form of diabetes can occur during pregnancy and requires careful management to ensure the health of both the mother and the baby. In this video, we'll provide you with valuable tips and tricks to help you navigate this condition with confidence. The first step in managing gestational diabetes is maintaining a healthy diet. Focus on consuming whole, nutrient-dense foods that are low in sugar and simple carbohydrates. Opt for plenty of vegetables, lean proteins, and whole grains to keep your blood sugar levels stable. Meal planning is key when it comes to managing gestational diabetes. Aim to eat regular, balanced meals throughout the day to prevent spikes and crashes in your blood sugar levels. Consider consulting with a registered dietitian to create a customized meal plan that works for you. Don't forget about snacks. Keep healthy options on hand, such as nuts, seeds, and berries, to satisfy your cravings without causing a spike in blood sugar. Planning ahead can help you avoid reaching for less nutritious options when hunger strikes. Incorporating regular exercise into your routine is another important aspect of managing gestational diabetes. Physical activity can help lower blood sugar levels and improve insulin sensitivity. Aim for at least 30 minutes of moderate exercise most days of the week, such as walking, swimming, or prenatal yoga. Monitoring your blood sugar levels is crucial when managing gestational diabetes. Work with your healthcare provider to establish a monitoring schedule that works for you. Keeping track of your levels can help you identify patterns and make necessary adjustments to your diet and exercise routine. In some cases, medication may be necessary to manage gestational diabetes. Your healthcare provider may prescribe insulin or oral medications to help regulate your blood sugar levels. It's important to follow their guidance and take your medication as prescribed to ensure the health and well-being of both you and your baby. Regular prenatal appointments are essential when managing gestational diabetes. Your healthcare provider will monitor your condition closely and provide guidance on how to keep your blood sugar levels in check. Be sure to communicate any concerns or changes in your symptoms to your provider for proper evaluation and support. Finally, don't forget to prioritize self-care during this challenging time. Pregnancy can be stressful enough, and managing gestational diabetes adds an extra layer of complexity. Take time for yourself, practice relaxation techniques, and lean on your support system for encouragement and assistance. Remember, with the right tools and support, managing gestational diabetes is entirely possible. By following these tips and tricks, you can navigate this condition with confidence and ensure a healthy pregnancy and delivery. Thank you for watching, and be sure to subscribe to our channel for more valuable information on maternal health and wellness.